of Victorians. More than 13% of Victorians aged 12 and above have now had their third dose of a COVID vaccine, and more than 93% of Victorians have had their second dose. And just yesterday, 20,726 Victorians got their third dose of the vaccine, and that's a terrific number. So we've seen really strong numbers this week come through our state vaccination centres to get their vaccine, and we continue to encourage Victorians to get their third dose to keep themselves and our community safe. In terms of the COVID numbers more specifically, we have, as of today, 644 people in hospital, and that's an increase from 613 as at yesterday. 58 people are in ICU with 24 on a ventilator. Very sadly, we had another 6 people pass away yesterday with COVID, and our thoughts and sympathies are with their families and loved ones. 21,728 people were diagnosed with COVID yesterday, and 68,202 Victorians were tested yesterday. And again, we thank those Victorians for taking the time to go out and get tested. And there are currently 69,680 active cases in the Victorian community. And as I've mentioned, on testing and both vaccinations, we've had a really strong response from Victorians this week on the numbers of people going and getting vaccinated. And just a day or two ago, we opened the booking for parents to book their children 5 to 11 years of age to get their child COVID vaccine, which the rollout in our state centres starts from next Monday. And in just the first 24 hours that the bookings were open, we've had more than 25,000 children were booked in to receive their vaccination. That's almost 5% of the eligible 5 to 11 population, and that's in addition to the bookings that have been made through GPs and pharmacies that are also offering the child vaccination program throughout the state. And we're seeing at our state-run centres that child-friendly environments are being finalised next week, ready to open from Monday to welcome children and their families to support them to get their vaccine. We also, on people looking to secure an adult or 12 plus vaccination, we have 167,000 bookings available right now for people who are wanting to get their third dose over the January period. And of course, bookings will continue to be made available on our system, and encourage Victorians to go and get that third dose as quickly as they can once they become eligible for that third dose. Also today, we're wanting to provide some additional information on how Victorians who test positive on a rapid antigen test will be able to self-report their result quickly and easily to in turn get the support they need to manage their illness. This online form has gone live as of today, and there's just 9 really simple and easy questions that people will need to step through that are very much in line with the sorts of questions and information that Victorians are asked when they go and turn up for a PCR test at state-run centres. It should only take a couple of minutes to work through these questions to answer them. And if people who want some extra assistance to fill out this form, or indeed are seeking some translation services for our culturally and linguistically diverse community, we'd encourage those people to go to the hotline where they can get information and assistance on how to complete the form. Victoria is the first state, on the first mainland state, to set up this system, and we're really pleased to be able to make this available as quickly as possible following the announcements yesterday about the role that rapid antigen tests are going to play as a community, as we go forward as a community to manage the latest iteration of the COVID pandemic. And it's important to remember that turning positive on a rapid antigen test is the same. It's the equivalent as turning positive on a PCR test. We'll be asking Victorians to, if you turn positive on a rapid antigen test, to isolate for the 7 days, to tell your contacts that you have turned positive. And it's important that we do also, as part of telling your contacts, isolating for 7 days, that we're asking Victorians to register their results on the Department of Health's website or through the hotline, is because it's so we can also make sure that Victorians have the care, support and information they need to help them through this period of time. For many people, they'll be able to manage their illness themselves at home, and that's going to be that'll be able to be supported through the information they provide through the registering of their positive RAT. But also too, if you do need some extra help and support, or if the symptoms do turn more serious, we'll be able to make sure you get the support you need, and that's where that's also going to play. That's why it's an important role that you do fill out that form either on the website or go through the hotline. But also too, moving to this system means that through a rapid antigen test, if you turn negative and you're not a household contact or you haven't been told you need a PCR test, it means you'll be able to go back to your normal life more quickly because of this change to both moving to rapid antigen testing and the reporting requirements that we're detailing today. Because we will see fewer Victorians needing to wait on the result of that PCR test before they can go and either receive the care and information they need or go back and return to life as more normals, which means less disruptions for all of us. So just before I finish up on COVID-related matters, again, encourage Victorians as you're getting tested, getting vaccinated, please do also, if you're returning a positive result on a rapid antigen test, to go and register that information on the website or the hotline, because it will be important to both help us to care for you, but also to help keep track of the cases across the Victorian community. And just finally, another reminder to please encourage Victorians to go and get that important third dose vaccination as well. Just before I hand over to Jerome to talk in a bit more detail on these matters, I did just want to provide an update on the weather situation we've been experiencing in Victoria over the past 24 hours. There has been some wild storms come through various parts of the state, and we've seen in the last 24 hours the Portland community in the southwest has been particularly impacted, where the Vic SES in Portland has received something like 100 plus requests for assistance as a consequence of flash flooding and hail damage. The Warrnambool Incident Control Centre has been activated to provide support for that community, and in addition to that, the Ballarat Incident Control Centre continues to remain active following the storms and the storm damage that was impacted on that community yesterday, with ongoing rapid impact assessments underway. There's also further additional statewide support on standby, given we are expecting more wild weather over the course of today, and this is a timely opportunity to remind Victorians who are to have the Vic Emergency app on standby to please check that. If you're travelling around the state, to please check our Vic Emergency app for weather conditions and any incidences. And another reminder too that to try and avoid driving in at times of high wind, and please do not drive through floodwaters. It is highly dangerous. And if any Victorians do need assistance as a consequence of any damage brought about by the storms and the weather, please call the Victorian State Emergency Service on 132 500. They provide a great support to our community in times of emergency and are absolutely on standby today to continue to provide that assistance. With those comments, I'll now hand over to Jerome. Thank you.
Thank you, Acting Premier, and good morning. So it's a positive move today to really move towards rapid antigen testing also being a diagnostic platform, given the state of the pandemic here in Victoria and indeed across the eastern seaboard. We're asking everybody who returns a positive rapid antigen test to please log on to the DH website and to report that positive rapid antigen test result. That will put you in the same process as anybody who returns a positive PCR. What it will mean is that we'll be able to give you ongoing updates and check in with you on your condition, and to make sure you get access to the COVID care through our primary and hospital healthcare systems. There are 9 really simple questions that we'll ask you when you register your positive rapid antigen test result. We'll ask you whether you've had contact with a known positive case, and we'll ask you whether you've had any COVID symptoms over the last few days. Most importantly, we'll ask you whether you're okay at home and whether you need any additional support, whether you need any other care or support that we can provide for you. We'll ask you whether you've been vaccinated. We'll ask you for details around your symptoms, how you're feeling and how you're going, and how ill you currently feel. We'll ask whether you have any other conditions, whether you've, for example, whether you've been through cancer treatment, whether you're pregnant or any other underlying conditions. And we'll ask whether you're okay for us to contact your GP and whether you're comfortable being handled by your GP. What these questions allow us to do, and we've been using these same questions in the same online system for our PCR positive cases over a number of months. What these questions allow us to do is to triage people to make sure that those who are able those who've got mild symptoms and those who are able to care for themselves, who've got the support of others around them, we'll keep a loose eye on them, but then essentially we'll let them manage themselves in the home. For that very small proportion of cases where the symptoms are more severe or where people need additional support to isolate safely at home, we'll provide sure that through our various services that we'll provide that additional support to people. So please, I'd encourage everybody, if you're returning a positive rapid antigen test result, please use that simple online and web form service, same as all of our as people returning a positive PCR test. We're finding at the moment with people who return positive PCRs that over half of them are responding really quickly to this message and really quickly to getting their details onto this web form, and it allows us to get care to people far more quickly. We're also, of course, in conversations with the Commonwealth to ensure that anybody who returns a positive rapid antigen test result and logs that result through the system can also access the pandemic leave payments, and we'll continue those conversations over the coming days. In terms of our wider testing system, as we've talked about over the last few days, we have put a significant order in place for rapid antigen tests to be made available through our testing system and through some other channels. I'm pleased to report that we are seeing some small orders start to arrive now. So we've had orders of a few 100,000 over the last few days, and we're expecting orders again in fairly small, modest numbers to come through in the coming days ahead. What that's allowed us to do is to start to roll out some rapid antigen testing at some of our testing sites. Yesterday, we used rapid antigen tests at 24 of our sites, mainly in metro areas, and we allocated around 5,500 rapid antigen tests to people who are coming in. Those who are asymptomatic were offered a rapid antigen test instead to take home, and of course to complete at home, and of course to return a positive result, then to register that onto our website. We'll continue to progressively roll out rapid antigen testing at more of our sites over the coming days. Obviously, there's some changes we're making to the way our sites are working, some changes to the queuing system and the information people get. I'd encourage you again, if you've got symptoms today, please come forward for a test. Come to any of our testing stations and we'll work with you to get you tested. 68,000 people did so yesterday and got their results yesterday, and we'll continue to see those numbers build over the days ahead. Again, please use our website to understand the current queuing times. We are continuing to see, of course, very busy testing sites, but we are getting through, and particularly as we start to introduce rapid antigen testing through our test sites, that process will become a little bit easier. Of course, rapid antigen tests, I know certainly our retailers and others are working hard to provide more rapid antigen tests into their environments. We're, of course, doing a lot to secure additional orders and to make sure they become available more widely to the community, and we'll keep updated on that over the days ahead. Finally, in terms of vaccinations, 745,000 third doses now delivered to Victorians. That's over 14% of the over 18s who are eligible have now had their third or booster dose. Really pleasingly, 30% of Victorians aged over 70 have now had their third booster dose. They, of course, were in the original tranche of vaccination, but it's really encouraging to see a good uptake amongst the over 70s. And I would really encourage people, there are still a good 1.5 million people out there today who are eligible for their booster dose today. Please come forward, go to your GP, go to your pharmacy, come to any of our 40-odd state clinics. If you've made a booking, that's great. It means it's a bit quicker and a bit more efficient. If not, of course, you can walk up at many of our clinics. Again, details on our website. Also, really excited about the 5 to 11s program. We'll have 40 state clinics running from Monday to deliver those 5 to 11 vaccinations, really focusing on our forester protection for our youngest of Victorians. They're being themed. I think they'll be very welcoming environments, and I know our paediatric teams are really looking forward to seeing many children come forward with their parents over the early days of next week. I can confirm that Commonwealth supplies of the paediatric Pfizer are starting to arrive, both into our clinics and into the GPs and pharmacists. So we're confident of being able to start the programme on Monday and are keen to get as many people vaccinated as possible. Finally, if you haven't booked your booster dose yet or booked your children yet, then please do so. Again, your GP, your pharmacy, or any of our state clinics will be pleased to help. With that, I'll hand back to the Acting Premier for questions. Thank you.
New South Wales has said today they expect their hospitalisation figures to triple over the next month. Is Victoria expected to follow that same path?
Look, there's no doubt we are going to see in coming weeks, if we continue to see an increase in cases as a consequence of the Omicron strain circulating in our community, then we are going to see increased admissions into our hospital system. In terms of what the actual numbers will be and how that mirrors what New South Wales is experiencing reporting, we will have to see based on what's the circumstances here in Victoria, what the actual numbers are. But yes, we the government, the health system as a whole, is preparing for an increased number of hospital admissions, and a huge amount of work has already gone on, as it has throughout the entire course of this pandemic, to ensure that our hospitals are equipped and staffed with the support they need. But there is an expectation that we will see those hospital numbers rise.
And also on hospitals, can I ask you about healthcare workers in hospitals? Some are reporting that they've been told if their partner has COVID, that they are testing negative, that they should still come to work and not isolate.
Yeah.
Is that happening in our public hospitals?
Well, there are some, and this is obviously assessed on at the hospital level. The hospitals administrations assess this with their own workforce. There are some exemptions, if you like, to existing isolation requirements for some healthcare workers under particular conditions, if they're a household-like contact, in that case that you've just referred to return to work within that isolation period. Now, that is there is a very strict exemption process in place that does include needing additional infection prevention and control measures put in place. It also involves the healthcare worker, undertaking a daily rapid antigen test, wearing an N95 mask, and agreeing not to share meal breaks in with other members of the workforce. And this is a matter that's being worked through very carefully with our hospitals and health system and their workforce, and it's being done with that very careful infection prevention measures over the top of it.
Certainly less than ideal if people can't isolate for 7 days when there's COVID in their household and they're working with people who might have other conditions or sick.
Well, look, there's no doubt that with the increasing numbers of case numbers and what the pressures that is putting not just on our health and hospital system, but also on a range of workforces, critical industry workforces in health and in other industries more broadly, there's no doubt that the increased number of people isolating is making it difficult for business as usual to proceed. And that's why there has been some very, very careful work be undertaken by the Minister for Health in consultation with hospital services, with unions representing the health workforce, to have these arrangements in place for household-like contacts to be able to, on this exemption basis process, to be able to return to work, to provide that ongoing support for a hospital system that is seeing increasing hospitalisation rates as a consequence of the Omicron strain in our community.
Have you heard reports of any healthcare workers who are still testing positive but who don't have any symptoms going to work?
I've not heard those reports, no. But I would refer you back to the work that the Health Minister is undertaking as part of the intensive work that's going on a daily basis with the Health Minister, the Department of Health more broadly, on supporting our hospital system, working through the unprecedented challenges that they're facing as a result of the increased case numbers, both in terms of who's presenting at hospital, but also in terms of the pressures that it's putting on workforces with increased case numbers and increased people isolating. But if I can go back to the what we were talking about just earlier, this is why moving to a rapid antigen test model will mean that the turnaround time for people waiting for a test result is dramatically reduced, because people obviously, within once the 15 minutes ticks over, you can get your test result straight away. So it will dramatically reduce the isolation period for people who are waiting to have the confirmation of their result, positive or negative, through the PCR system. Pardon me.
Just in terms of restrictions, New South Wales is closing nightclubs and dance halls. We've recommended that people avoid dance halls. Is this the next step for us in Victoria?
Look, I've seen those reports this morning coming out of New South Wales. I'm not sure if the New South Wales Premier has confirmed those reports yet through the media, and I think you can understand we'll let New South Wales make their own announcements. The announcements made, though, yesterday by Victoria, the changes to the settings that came into place at 11:59 p.m. last night, that were announced by the Health Minister and the Acting Chief Health Officer yesterday, are broadly in line with the existing New South Wales settings, and obviously there's that reporting that those settings may be changing further following some announcements by the New South Wales Premier today. We'll continue to monitor both. Obviously, we'll very carefully monitor the situation here in Victoria, but we do, and I know the Health Minister is in regular dialogue with his colleague in New South Wales. We'll monitor closely their settings and the impact it may be having on helping manage the spread of the virus in the community, and we'll continue to, though, do that in the context of reviewing what's appropriate for Victoria and those common sense settings and common sense measures that we need to have in place to protect the Victorian community.
Is there any thought to giving financial assistance to the hospitality industry, or is the bucket empty?
Look, I know this has been canvassed previously. I think just yesterday the Health Minister went to this as well. At this stage, we're not in a position to be able to provide that business support at this stage. Obviously, the hospitality industry, as we just talked about with the health care industry as well, many businesses, many workplaces are facing some challenges with availability of staff as a consequence of the higher numbers of people isolating or indeed contracting COVID. But we're not in a position at this stage to provide that support.
Many hospitality, many restaurants and cafes are only half full or less than that anyway. So I know a lot of the industry leaders, after the announcement, were not too fast because it wasn't going to impinge on some massive surge in business that was happening. Did you guys consider going any harder yesterday? Was anything else on the table, or was hospo caps the only thing you guys considered?
Oh, look, I'll leave it to the Minister for Health to talk because it's his responsibility under the pandemic legislation around what other measures may or may not be considered. And of course, further information will be provided following yesterday's announcement. But it goes back to at making the assessments at the point in time of what's appropriate in the Victorian context. And the decision that was taken yesterday and announced by the Minister for Health about those DQ2 settings for hospitality was deemed an appropriate measure at this time. We'll continue to monitor very carefully and very closely the ongoing circulation of the virus in our community, the impact it's having on business, on industry, but also on environments like caring environments, whether it's in our hospitals, our aged care settings, our disability care services. There's a lot of different parts of our community that are facing some challenges in supporting their workforce during this difficult time, and that is one of the considerations and inputs that the Minister for Health considers in making decisions about future settings.
I have questions about Novak Djokovic. There are reports this morning that federal health authorities told Tennis Australia on 2 occasions, both in writing, that people who were not vaccinated and had COVID in the last 6 months would not necessarily be granted entry. Who in the Victorian government saw those letters?
Well, by the very nature of that was correspondence between the Commonwealth Government and Tennis Australia. I'm advised that the Victorian Government or members of the Victorian Government hadn't seen that correspondence, and you'd expect that we wouldn't necessarily see that because it was correspondence between the Commonwealth Government and Tennis Australia. But it also reinforces that point that it is the Commonwealth Government, as has been reaffirmed on a number of occasions in the last 24 hours by the Minister for Home Affairs. It's the Commonwealth Government that's responsible for issuing visas, and how they engage in that dialogue with bodies like Tennis Australia is a matter for them.
So, Acting Premier, you're saying that no one in the Victorian government who is holding the Australian Open spoke to the federal government about whether he would be allowed in or not.
So let's be clear. The role of the Victorian government here, as host of the Australian, the city and the state that hosts the Australian Open, is to run a safe event. And that is that has been the primary focus of having the Open, which starts in a week or so, having all the arrangements in place for the event to be run successfully and safely. That's the role that the Victorian government plays and its agencies plays in various assessments. How people participating in that event get into the country is a matter for the Commonwealth Government, who are responsible for issuing visas for people to enter the country. It's not the Victorian Government who issues visas, it's the Commonwealth Government, and how they enter the country, how players and other support staff enter the country is a matter for the Commonwealth Government.
Do you think that they thought that was a huge breach of trust, that the Victorian Government wasn't involved in the discussions between Tennis Australia?
Well, for events, for business activity, people come and go from the country on a regular basis. We're not involved in the movement of and the issuing of visas for individuals who may be entering the country for work, for business or event purposes. That's not our role, and I don't think Victorians would expect it to be the Victorian government's role. We've got a very big and challenging role and responsibility every single day in supporting a health system, in supporting an education system, in supporting a transport system. That's our role as a Victorian government. We don't involve ourselves, because it's not our responsibility, in the issuing of visas. That's the federal government, the Commonwealth government responsibility, and how they engage with organisations like Tennis Australia is a matter for the Commonwealth government.
So just to be clear, the advice you've got is that the letters from the Health Minister explicitly saying that this exemption would not pass muster, that was not communicated to Victorian officials by TA?
I'm advised that the Victorian government officials were not aware or had not seen that correspondence, and as I've said, that's not that unusual, because it's correspondence between the Commonwealth government and Tennis Australia as to how players and support staff come into the country. How the issuing of visas is undertaken is a matter for the Commonwealth government, and any communication they have with Tennis Australia on that matter is correspondence between those two parties.
And when you say Victorian officials weren't told, do you think that that extended to the Victorian expert medical panel who approved the exemption? Do you think they were unaware that the federal government would not think that was viable exemption?
Well, there's an important distinction to make here. How people get into the country, in this case, to participate how people enter the country to participate in a tennis tournament, and the visa that they're issued to enter the country is a matter for the Commonwealth government. The role of the panel was to ensure that once players, and indeed other support staff associated with the running of the event, how those people were in Victoria, and that we could operate a safe and successful event. That was the role of that panel. If there were to be any exemptions applied for, the role of the panel was to independently assess those applications. That was very much done at arm's length, as has been talked about previously. It was a de-identified process. It did not identify individual players or support staff. But that can only come into effect once people have arrived in the country. You can only participate in the tournament if you've been granted the appropriate visa, and that's very much a matter for the Commonwealth government.
But Acting Premier, it was a joint exemption process between Tennis Australia and the Victorian government. So shouldn't they have liaised with the federal government about him entering?
Well, again, how players and support staff enter the country to participate in the Australian Open, as has been confirmed by the correspondence that you're referring to, is a matter for the Commonwealth Government and Tennis Australia, and that's communication that's held between them. The role of that panel was to, once people were identified as wanting to come to Australia or wanting to participate in the tournament and did not meet our very strong vaccination requirements, there was that independent process established to only purely assess their eligibility for a medical exemption under the ATAGI, the national guidelines that are in place for assessing vaccine exemptions. That is separate, though, very much separate to the visa process. Only the Commonwealth government can grant visas for people and players wanting to enter the country to participate in the Australian Open.
If that's the case, do you think the panel should have spoken to ATAGI or the feds?
Well, the panel, and again, there was a two-step process here. One that involved the ATAGI process, and then the independent panel that reviewed de-identified documentation of individual players and support staff based on that nationwide, the settings we have as a nation on medical exemptions that are set by ATAGI. Their role, the role of the panel was to assess the medical documentation, not to assess their eligibility for a visa, because that would not have been appropriate, because that is only the responsibility under our constitutional arrangements of the Commonwealth government.
The border officials let in a player and an official in the weeks before Djokovic arrived on the same exemption that he had. So they applied some different level of rigour when Djokovic arrived. Does the Victorian government believe that there might have been a political element to the way Border Force officials acted? Do you think the federal government might have instructed them to take a harder line on Djokovic?
Well, we're not. It's the Commonwealth Government that Border Force reports to. It's the Commonwealth Government that have the accountability and authority for how Border Force and the actions it takes. Other circumstances of people that the Commonwealth have or haven't let into the country is a matter for them. That's not a role for the Victorian Government to provide a commentary on who Border Force may or may not let into the country.
The cancellation of medical services, elective surgery is obviously causing a lot of angst in the community, particularly IVF services. Why have they had to be cancelled for every reason?
I'm not sure if Jerome has any additional information on that specific example around IVF services. We'll have to get some more information and come back to you. There was the information provided a day or so ago about some elective surgery not proceeding to provide for that extra capacity that we need in our health system for both supporting our hard-working healthcare staff who are working around the clock to provide support to Victorian patients, but also to free up capacity because of the increased hospitalisation as a consequence of COVID. But in terms of what specific services have been affected, we'd have to come back with some further information.
With the RAT reporting system, is the government going to ask for proof of a positive RAT, or just taking it on their word?
I think under the system it's a self-declaration process, and I'm confident that Victorians will appropriately declare their testing status as a consequence of using a rapid antigen test, because we've seen throughout the whole course of this pandemic, Victorians understanding their individual role as part of our broader community effort to protect Victorians, protect the community from the impact of this virus. And that's why we're seeing the way Victorians have been wearing masks, doing the check-in of QR codes, but also most importantly, responding to the call to go and get vaccinated. And as I've just mentioned, 20,000 people yesterday went and got their third dose. We've had 25,000 kids being registered to get their paediatric vaccine next week through our state-run centres. We are seeing a very, very strong response from Victorians about the measures that they're being asked, the role that they're being asked to play in supporting our effort to deal with the COVID virus.
Can I ask you a question on testing?
Of course.
Obviously, we're not directing people to have to get lab tests in the first instance, but
Yeah.
how are the queues going today? And is it are they still long now being supplemented with people looking for rats at those sites? How are you managing it?
Yeah, look, so I mean,
They do look small. They do look less busy.
yeah, look, I mean, the sites remain busy. That's first out. And I think we've all seen over the last week, some very long waiting times of 2.5, 3 hours even. And look, I apologise again and appreciate hugely the amount of time and effort people have put into making sure they can get their PCR test done, particularly over this really complex week of the last 7 or 8 days or so. In terms of what we're seeing now, we are providing rapid antigen testing to people who are turning up at PCR testing stations because they want to test. So, it is not there aren't pallets of tests at testing stations you can drive up and just help yourselves. This is people being allocated one rapid antigen test when they turn up for a test at one of our PCR testing sites. We're still recording the same information around people's details, their Medicare details, and of course why they're coming forward for a test at all. The clinical teams on the sites will make a decision about whether you're more appropriate to have a PCR test or a rapid antigen test. And as I said, yesterday we handed out 5,500 of those. There are some site-by-site issues we're working through, so obviously we're keen to minimise the number of people who are having to queue for a long time if we judge that they're best suited for a rapid antigen test. But this is not by any means an open invitation or a free-for-all to come to our sites. People are being assessed, triaged at those sites, and you'll either be asked to get a PCR test or you'll be offered one rapid antigen test to take home to do it there. If that turns out to be positive, then you've got the website reporting system to go into.
How are you feeling about the site itself? You've got it up really quickly, but there's
Yep.
always a few nerves around when we put something up so fast. Do you think it's going to get a handle of traffic?
Oh, look, I mean, there's always the usual angst you have when you launch anything. We saw the same thing when we opened up yesterday, the 5 to 11 site, which has gone really well. And as the ex-premier said, 25,000 bookings made in the first 24 hours or so. So we're really pleased to see that get off to such a good start. Again, I know many Victorians will be sitting on positive RAT results today, or even yesterday or the day before. We would encourage you to log on to our DH website to use that web reporting form. We've got capacity for 50,000 RAT tests to be reported up every single day. We can increase that capacity should we need need to do so, and we'll watch those results very closely. So a lot of people working behind the scenes to make all that possible, and it builds on the experience we've had over the last many months of processing PCR results in exactly the same way.
My last question, or perhaps comment, it'll be interesting to see the numbers tomorrow, given the rats that come. Do you have any predictions, or are you just going to wait to see?
Yeah, I don't gamble, so we'll be very happy to report tomorrow what number of both PCR results we've processed and the number of rat tests that are coming through, and of course we'll be very interested to see what that tells us. And look, we've seen and we saw in the original Doherty model that went to National Cabinet two weeks ago now some very alarming projections in terms of total case numbers. We've seen both here, the fact we've got another day of almost 22,000 positive case results. 38,000, 38,000 again in New South Wales. These are numbers that are unthinkable even 2 or 3 weeks ago. So we're all having to adjust rapidly to a changing situation. And there's two things for that. One of which is increasingly important to use a rapid antigen platform as a practical ways to get more information to people more quickly so people can effectively isolate as soon as they have an indication of a positive result. It's a really important tool for that. But also to make sure that we can ensure that we keep people moving as quickly as possible and we all adapt to the new environment that we're all having to get used to.
The 9 questions, the triage,
Yeah.
to try and help people manage the condition at home. Are case numbers about to get to the point where people will have to accept they may not hear from a health service even if they're really ill, that even if they fill out those 9 questions, it's not a guarantee that someone's going to reach out to you because there are so many cases?
No, so we will continue to focus all of our resources and all the energies we have on the most urgent and priority cases, and I think that's what everybody would expect us to do. I think we've got our health teams have got an exceptional record over the last 2 years of making sure they provide care to those people who really need it, and that's why that triaging system is so important. We're always going to start with those who report the most significant symptoms or who have the most significant need for wider relief and support. So that is why those systems are there, and we will continue to push that through. Today we'll be contacting tens of thousands of people today to check in on their symptoms, to see how they're going, and as the numbers continue to build, we'll continue to bring more people on to do exactly that kind of triaging work.
Can you just explain why, if you have tested positive on a rat but haven't been in contact with the case and also are not feeling unwell, you're recommended to get a PCR still?
Yeah, look, I think that's right, and I think, Paul, that situation will continue to evolve. So certainly, I think the main point for us today and over the last few days is if you can get access to a rapid antigen test more easily than a PCR, then please use it and use that to establish whether you're positive. I think in fairness, I think increasingly we should all be aware that we're all coming more and more into contact with positive cases, either through known associations or just through our day-to-day movements. But yeah, if you've got no symptoms and you've got no awareness of where this might have come from, then absolutely, if you can get access to a PCR easily and you're willing to come forward to one of our test sites, then please do so. If you're not, then treat yourself as positive, report the result to our website and continue to isolate.
And the reason for that is just because of the chance for a false positive, right?
Yeah, there is, as we've seen, and I think as our acting chief health officer reported yesterday, there is it is a less accurate test than a PCR. We've always been very clear about that. That's why for us, rapid antigen tests were not something we needed when we were dealing with the previous variants of COVID, because our PCR system could handle it. With the numbers we're seeing now and the rate of speed of Omicron, and the less severe nature of it, of the way it's playing through, rapid antigen is a really important tool for us to use. But there is a higher error rate. If you're concerned, you've got a positive result and you want to verify it, by all means come forward to get a PCR test. But again, we're going to continue to focus our PCR resources on the symptomatic and the people who need it most.
Can someone with a positive rat access Commonwealth-based financial support, and if not, how far off is that?
Yeah, so look, we're continuing. I mean, that's certainly our intention, and we're continuing those conversations with our colleagues in the Commonwealth, and I think there's a general understanding that's a good thing to do. We've been relatively quick out of the blocks on getting our reporting system up and running, so we'll continue those conversations with our colleagues in Canberra.
Is there anything stopping someone unscrupulous from falsely reporting with no proof that they have a positive rat in order to gain that financial support?
Oh, look, I mean, it will be a completely antisocial, obnoxious thing to do. So if people want to go and report a non-existent rat into the system, and if you want to then clog up our healthcare system in terms of another person for us to contact and triage and make sure you're okay, that's a pretty shabby thing to do. So are we going to spend huge amounts of energy in putting more hurdles in the way of people who have a genuine reporting need? No, we're not. Because I think the focus for us now, the increasing concern we've got, is that there are many Victorians out there who are now starting to get access to rats. That's a good thing, but who need to go somewhere with that information, and that's what our focus has been.
And is there any more information on how the 44 billion rats will be distributed? Obviously, we're seeing some at testing sites now.
Yeah.
How will the others be?
Yeah, so look, I mean, we're as we obviously we're very keen to get our larger orders coming through. We've got teams right now, in China and in other countries, working actively with those suppliers to make sure they deliver on their commitments that they've made to us. So there's a lot of on the ground work happening to drag those tests, kicking and screaming back into our stocks. We'll continue to announce as we start to see those numbers and those volumes we have build. We'll start to have more options about how we distribute. Right now, obviously, the focus for us is to use it to relieve the testing system and to provide that platform coming through. We're also starting to work closely with some of our more vulnerable and at-risk communities in providing rapid antigen testing awareness and some tests into that environment. We'll do more of that over the days ahead, and we'll talk to you about that when we do so.
Currently, there's financial support available to close contacts that they've been directed to isolate or they're awaiting a result on a PCR test. Going forward with the rapid testing system, how will close contacts be able to claim financial support if they haven't been working for 7 days?
Yeah, so look, again, these are conversations we continue to have with the Commonwealth under the context of the pandemic leave arrangements and how those are going to work in this rapid antigen testing environment. What I would say to Victorians now is that the most important thing you can do is if you've got a positive rapid antigen test, please record it with us. That will give you a unique identifier number. It will register your case, so you'll have something to go back to. It allows us to provide immediate relief and clinical support if that's what you need. So that's the most important thing. We'll, I'm sure, catch up with our colleagues in Canberra to see how we then, if there's financial support can be extended, how that will be delivered through that system.
May I ask one more for the actual?
Yep.
Stay with Jerome for one more.
Sure.
I'm sure you both think you're in some business at the moment about how difficult the furloughing rules are and the effect it's having on staffing.
Yeah.
I know we only liberalised the close contact rules, whatever it was, a week and a half ago. Is there more that can be done to ease the burden on business at the moment with furloughing rules? Is that something you're looking at?
Yeah, look, and it's similar to the questions earlier around healthcare worker furloughing. So look, I think the most important thing. Yeah, I mean, I think so. Well, let me deal with healthcare workers. I'll come on to the broader piece, Paul, if that's okay. So look, so there are certainly our health services and staff representatives of our healthcare workers have agreed a set of arrangements whereby it is possible for healthcare workers who are in quarantine because they are household-like contacts or lesser contacts, if I can put it that way, to come back to work under very tight arrangements. And the acting premier spoke to that. That is an option for healthcare services and their staff to work through if that's what they choose to do. And it will be increasingly important because today we've got over 3,000 healthcare workers that are furloughed, not able to attend work, and that's a significant pressure on our healthcare system. We were certainly willing to explore with other sectors, particularly critical sectors where getting staff in is important to the maintenance of really important services. If I look at supermarket distribution centres, or if we're looking at the emergency services, and especially people working so hard today to deal with the floods, there are arrangements in place again whereby those furlough arrangements will be able to be adapted if alternative measures can be put in place. The obvious one for us is the use of rapid antigen testing on alternative controls that minimises that risk. So that's what we're doing to your point, Paul, to maximise the available workforce if people are asymptomatic and if they're testing negative on a rapid antigen test. Obviously, some work will need to be done by individual sectors to make sure that those arrangements work for them and are sufficiently safe to do so.
The Novak Djokovic saga, are you worried about the effects it will have on Melbourne's reputation as a global major events capital?
Melbourne and Victoria has an outstanding international reputation to successfully host major events. The Australian Open, the Grand Prix, our cultural events, major theatre shows. We are a well sought after destination for these sorts of events to be held, and I'm absolutely confident that that reputation will continue going forward as we continue to host major events like the Australian Open that's coming up in the next week or so, and other events over the course of this year. Importantly, and we manage these events in a safe way, that will only enhance our reputation to be able to hold these sorts of events.
Sorry, I'm really sorry, Jerome. Can I just get one more? I just got one texted through. I'm sorry.
If it's an easy one.
It's an easy one. All right, good. I'll get shouted at if I don't ask it. Why are we not doing vaccines for kids in schools as the Premier flag might be done last year? So 5 to 11-year-olds, why are they not being vaccinated?
I'm not saying where we will be. I mean, number one, schools aren't open next week, to the best of my knowledge. My kids are a bit older, but I'm pretty sure they're not open next week. So from next week, we'll be opening in pharmacies, in GP clinics, and in the 40 state clinics that have been set up to run, particularly to be a welcoming and positive environment for children. There will be a number of school sites that we'll use towards the end of January and into February. So we'll announce those as and when we get to that point. My message now is to parents of 5 to 11-year-olds, get them booked in and get them lined up at the GPs and pharmacists and at the state clinics.
And do you have any projections on the 5 to 11-year-old numbers, like per week, how many you'd like to do?
No, not at this stage, Paul. I mean, obviously, we're very keen to see them come forward as quickly as possible. We also have, healthcare workers, and particularly paediatrically trained healthcare workers, ready to give those vaccines. Those staff, given the wider pressures on the healthcare system, will be under more pressure as the weeks go on. So the sooner we can get it done, the more we can bring it forward, the better it will be for all concerned.
Thank you.
Thank you.